Let's talk about the measles outbreak linked to Disneyland. Well, guess what? It's now growing, with nearly 100 cases reported across 8 states now and even Mexico. This is we're learning most of those infected with the contagious disease not vaccinated. Meantime, the results of a new study revealing vaccine skeptics tend to cluster together in like-minded communities. If you look at your screen there, you can see what I'm talking about, making an outbreak all the more dangerous. Dr. Robert Lahita is chair of medicine and vice president of Newark Beth Israel Medical Center. He's also professor of medicine and adjunct professor of molecular biology and biochemistry at Rutgers, New Jersey Medical School. That is one long title. Hats off to you for all those titles.
Thank
all right.
you, Gretchen.
Epidemic brewing here.
Yes, there is.
Okay. You had the Disneyland situation. Kids who weren't vaccinating getting sick. But why are we seeing so many more parents deciding not to vaccinate their kids?
Well, there are parents in California in particular who have what are called PBEs, personal belief exemptions. That can be from religion or a belief that getting vaccination will harm your children. And the most obvious one is autism, which has been poo-pooed and has been discussed around the world and has been shown scientifically to hold no water. That's the big scare. So people in affluent communities who tend to be liberal and intelligent read the web, read the literature, and are convinced that getting their children vaccinated puts them at risk.
So they don't do it, and that number is growing. You believe that as many as 10% of all California kindergartners are not vaccinated for the measles.
That's right.
Or any other thing.
That includes private and religious schools where we have very little data. We do know that upwards of 4% of the children that are registered in public schools have not been vaccinated in California.
Okay, now let's talk about how this has surged over just the last 14, 15 years. Look at these maps.
Yes.
So the vaccinations in 2000 there on the left of your screen, you can see that there's not as many. Look at 2014. This has gone up exponentially as far as the clusters of people. Now, how do clusters affect, doctor? How does that make it more contagious and spread more quickly?
Well, obviously there are children in those areas that are not vaccinated, and so they tend to give the disease from one to one. We have what's called herd immunity, which a lot of people who aren't vaccinated pray for, and that is the virus spreads from those children that either have the disease or children who have been vaccinated with the vaccine, but their children are not injected and not vaccinated. Herd immunity is a poor way to go and a poor belief to have.
All right, this is, a very controversial topic because a lot of people believe that they shouldn't vaccinate their kids.
Yes.
And so I wanted to look at the CDC.
Yes.
They do give examples of kids who should not be vaccinated.
That's correct.
So kids who have HIV, kids who have cancer.
Right, whose immune systems are not up to snuff. These are immune systems that are deficient. Children with lymphoma, leukemias, children with immunodeficiencies that are inherited. They should not be vaccinated. But we all know who they are. Doctors know who they are. There are certain means that we have to protect those children.
Right, so not the general population would not be your recommendation. And in fact, it comes full circle because now there's a sick child's father out in California. His child has cancer.
That's right.
That child can't go to school now.
That's right.
Because the child can't be exposed, so he wants everyone to be vaccinated.
It's a very sad situation in cases like that where an infected child or children can come into the school and infect the entire school, especially those children who are not vaccinated.
All right, doctor, thanks so much for coming in.
Thank you.